Dr. Stanford, you made a presentation at Glaucoma 360 on the management of end-stage glaucoma. Could you give a summary of what you presented?
Sure. Thank you for asking me. So, end-stage glaucoma is a difficult problem for all of us. Where ourselves are frustrated because we haven't been able to help the patient, and the patient, of course, is not only frustrated, but also losing their vision. So I think we want to do our best to try to first control the disease if we can. But we also have to be mindful of the cost. I'm not talking about dollar cost, I'm talking about the cost in pain and discomfort to the patient. So at some point, we just have to open the conversation with the patient. How much more do you want to go through? How many more operations? At some point, maybe we just have to let it go. And if you do start that conversation, you also need to start the conversation with the patient about how to live their life differently. So it's not just the medical issues, but the social issues of what it means to have just a little bit of vision left.
So as a clinician, at what point do you decide that we have to have this conversation?
I think if the patient is going downhill despite your best efforts medically and maybe one or two surgical procedures, and you realize that you're losing the battle, one thing you can do is ask a colleague to take a look just in case you've overlooked something. Mm-hmm. All of us can overlook something once in a while. But I think once you start to see that things are not going well, I think it's a good time to open the conversation while the patient still has some visual capability and can get to the resources to help them to learn how to live in a world where their sight may not be the same as it was when they were younger.
So in the bottom line for the clinician, what should they be aware of when it comes about the management of end-stage glaucoma?
Well, I think we need to acknowledge when we're losing the battle, let the patient get their frustration out, and then help the patient to begin to live a different life. It's not, losing your vision is not the end of life, it's just a different life. And many people, most people who've lost their vision can still have a meaningful and wonderful life. They just need to prepare for it. And the clinician's job is to help them do that.
Thank you, Dr. Stanford. Appreciate your time.